Do not forget, click the subscribe button, and hit the bell icon. Vaginal birth versus C-section. Pros and cons. Both cesarean section, C-section, and vaginal delivery, normal delivery, are methods of childbirth, each with its own advantages and disadvantages. The choice between the two depends on various factors, including the mother's health, the baby's health, and the specific circumstances of the pregnancy. Here is a comparison of C-section and vaginal delivery. Pros of C-section. 1. Indications. C-sections are typically performed for medical reasons, such as breech presentation, multiple births, placenta previa, fetal distress, or maternal health conditions that make vaginal delivery risky. 2. Control timing. C-sections can be scheduled in advance, allowing for better control over the timing of the birth. 3. Reduced risk of birth trauma. C-sections may reduce the risk of birth trauma, or injuries to the baby, such as shoulder dystocia, or head molding. 4. Reduced risk of incontinence. There is a reduced risk of urinary incontinence and pelvic floor issues in the mother after a C-section. 5. Predictable recovery. Recovery is generally more predictable, and may involve less postpartum pain than vaginal delivery in many cases. Cons of C-section. 1. Surgical procedure. A C-section is a major surgical procedure with potential complications, including infection, bleeding, and longer recovery times. 2. Risk to mother. It carries a higher risk of infection, blood clots, and injury to organs compared to vaginal delivery. 3. Risk to future pregnancies. Multiple C-sections can increase the risk of complications in future pregnancies. 4. Delayed initiation of breastfeeding. Mothers may experience a slight delay in initiating breastfeeding compared to vaginal delivery. Pros of normal delivery. 1. Natural process. Vaginal delivery is the natural way of giving birth, and it may have benefits for the baby, including exposure to beneficial bacteria, and a potential lower risk of respiratory issues. 2. Faster recovery. Recovery is generally faster after a vaginal delivery, and there is usually less postoperative pain. 3. Fewer surgical risks. There are no surgical risks associated with vaginal delivery, such as infection, or anesthesia-related complications. 4. No incision. Vaginal delivery avoids the need for a surgical incision in the abdomen. Cons of normal delivery. 1. Unpredictable timing. The timing of a vaginal delivery is less predictable, and can be more prolonged. 2. Risk of birth trauma. There is a higher risk of birth trauma, including perineal tearing, which can require stitches. 3. Potential for labor complications. Labor can be physically demanding, and may lead to complications such as shoulder dystocia, or fetal distress. 4. Incontinence and pelvic floor issues. Vaginal delivery can increase the risk of urinary incontinence and pelvic floor issues in some women. Ultimately, the choice between C-section and vaginal delivery should be made in consultation with a healthcare provider. The decision will depend on various factors, including the mother's health, the baby's health, the pregnancy's progress, and any medical indications. Both methods have their place in modern obstetrics, and the primary goal is to ensure the safety and well-being of both the mother and the baby. Thanks for watching my video. If you want to update, please subscribe my channel.